Welcome back to Paragon Chiropractic. Today we're going to be talking about neck pain and how that may present itself. Here we have a late patient in the late 20s, right? Started suffering from pain, has been suffering from pain for a few years on and off. The pain was just all of a sudden, it was insidious, meaning it just started over time. There was no real like trauma, slip, fall, anything like that at the onset of the pain. So what he was feeling was burning sensation, base of the neck, a little bit of tightness in the neck, led to migraines here and there. The pain would it would go through periods of increased pain, and then it would subside, and then it would come back. And I think in the last few months, the pain's just really prominent, and it's kind of interfering. He feels it during work. So he spends a lot of time on the computer, so the desk, because of work. So that's more or less what he's been feeling. It just became like a nuisance, and that's why he came in. Oftentimes, patients do wait until it's interfering or it just becomes a hassle to come in for the pain, and that's fine. That's why we're here to help you kind of get back to your daily activities without that pain and without that discomfort.
But don't wait so long, right?
Yeah, no, definitely don't wait that long. You gotta come in. Preventative care is key. That's something we'll also talk about in another video. So stay tuned for that one. All right, but yeah, don't tighten it. There you go. There you go. And then you're going to right there. Cool. And just relax. All right, does that look good? Check out. All right, so a lot of people wonder what cupping is for. Simplest way to describe it, there's many uses, many applications for it in which it can be used. But the simplest form, the easiest way to explain it is it just increases blood flow to the muscle that's tight. When a muscle is tight, it's because it lacks minerals, specifically calcium and magnesium. You find that's found in the blood. So when you put a cup, it suctions blood into that area, so it brings blood flow into a muscle that needs a little bit more blood and nutrients. So it's a way of giving a muscle that's tight some nutrition, if you will. And then so gets the muscle to relax and calm down, and allows us to kind of manipulate the spine and adjust a little bit easier.
Oh, nice. Ooh.
Let's go.
I felt like that other time when the
The
blood
rush.
just.
There you go, face down. Deep breath in and breathe out. Deep breath in. Deep breath in. Pop on up, walk around, see how that feels. It's still gonna be sore because with the action, you know, you felt a little bit, you injured the ligament a little bit. It's a little bit of like a stretch on it. But yeah, that ankle was off. So things to like look out for that is if your knee starts to like lock out on you, or if it just gives out, then let me know. But I think give it a few days. All right, guys, hope you guys enjoyed that. Just a little preview of what upper cross syndrome treatment may look like. There's a lot of other modalities that can be applied depending on your signs, symptoms, and what, you know, the root of or onset of the pain. Hope you like the content. There's a lot more to come in regards to explaining tension, neck pains, causes, variations of injury. If you like, don't forget to subscribe and follow us for some more content. Thank you.